How to use repertory, page number 315 to 317.
How to use the repertory. Ever since the appearance of my repertory in print, many of my friends who use it have urged me to write out my own method of using a repertory. I realize that it is a most difficult undertaking, but shall attempt to explain my method. I doubt not, but most careful prescribers will find that they are working in a similar manner. The use of the repertory in homeopathic practice is a necessity if one is to do careful work. Our materia medica is so cumbersome without a repertory that the best prescriber must meet with only indifferent results. After the case has been properly taken according to Hahnemann's rules, it is ready for study. I do not intend to offer in this manner the ordinary rubrics because all know them so well. A case that is well taken and ordinarily full will show morbid manifestations in sensitiveness to my surroundings, such as weather, heat and cold, also in the desires and aversions, mental symptoms, and the various regions of the body. When I take up a full case for study, I single out all the expressions that describe the general state, such as the aggravations and ameliorations of the general state of the patient or of many of his symptoms. I next consider carefully all his longings, mental and physical, all the desires and aversions, antipathies, fears, dreads, etc. Next I look for all the intellectual perversions, methods of reasoning, memory, causes of mental disturbances, etc. All these I arrange in form together in order to set up opposite each one all remedies in corresponding rubrics as found in the repertory. By the cancellation process, it will soon be seen that only a few remedies run through all these symptoms, and therefore only a few are to be carefully compared in order to ascertain which one of all these is most like the particular symptoms not yet lined up to be considered as the first ones have been considered. Hahnemann teaches in the 153rd paragraph that we are to give particular attention to such symptoms as are peculiar and characteristic. He teaches also that the physician must pay his earnest attention to the patient. Now, if these two things are duly considered, it will be seen that Hahnemann's idea was that a characteristic symptom is one that is not common to the disease, but one that characterizes the patient. All the first lot of symptoms singled out for a more comprehensive view are such as characterize the patient and are predicated of the patient himself. By treating a portion of the symptoms in this way, we have reduced a list of possible remedies to a few or perhaps only one, as it is necessary to consider the totality of the symptoms for a basis of the homeopathic prescription. It is now necessary to examine all the rest of the symptoms in order to ascertain how these few remedies correspond with all the particulars.